how do I live in this world of cancer and also keep my life together in a way that's just a lot more blurry, right? And it's scary.
Yeah, and hopefully for a long time.
Right.
You know what I mean? And
Yeah.
and this is what I think a lot of the listeners to this podcast, they are entering in or have been in this period of time for a long time now. So,
well, and people do stay here for a long time.
Yeah.
But it is not without its roller coaster ride, you know? And this is also something that makes, I think, metastatic or stage 4 a lot different from the other stages, right? You are trying to figure out how to live your best life with cancer for as long as possible.
And everybody in your life thinks you're done with cancer because you are not doing any of those visible treatments.
Exactly.
Yeah.
So that's the other thing. I think a lot of people might actually downplay it because you're not going to have maybe those outward signs. You're not going to be bald. You might, you know, your treatment might be pretty manageable, but it doesn't change how severe the diagnosis is and how scary it is. It just puts a different spin on it for other people.
Yeah,
So,
in some ways it even makes it scarier.
for sure.
For sure.
Absolutely.
Because you've already been through the treatment. You know what it's like. There is no fear of the unknown. It's fear of the known. And that's not great.
Yeah.
So what are people getting in this guide?
So with all of the 5 to Thrive guides, we're going to go through the 5 areas that we kind of had honed in on in our past series as being kind of crucial components to managing cancer in a way that is helpful. So there's tips about your mental or mindset, physical, nutrition, medical, and support. So by medical, we mean kind of how to work alongside your medical team and those kind of things. We do not provide medical advice. And honestly, it's not something that I spend a lot of time on in terms of, I'm not an expert in any way, shape, or form of knowing about even the different breast cancers and all the different things that go along with that. So
By choice.
by choice.
Yeah.
Yes. Yeah, for sure.
Which she is not an expert in the medical side, but I would say you are an expert in the mental side. And that's the first part of this 5 to Thrive part here. I do believe you're next, whether it's just by practice or by choices you made or just by your DNA. This is your strength. So why don't you talk to us about what somebody downloading this might get from the mental part?
Yeah, so let's just, you know, every part of this starts with kind of a letter to you. And I know I started this out by saying, like, this is kind of your new normal. So I just want to address that in terms of sort of the mental side of things, too. I feel like we're creatures of habit and like homeostasis, and we want to get back to normal. And I think it's really one of the first things that you really have to spend some time thinking about is that normal is gone. Like, it's gone. You can build a new normal, and it can be great. But I thought of it as like, why would I want to go back to a normal that got me to cancer, right? So what are the things that I think maybe along the way were not helpful or whatever it is? And it doesn't mean that I did something wrong to get cancer. It just was a period of time to evaluate what was working for me and what wasn't working for me. Just like if you lose your job or if you know what I mean? You do have an opportunity rather than wallowing in the why me, all of that kind of stuff, to kind of go, okay, wait a second. I didn't ask for this and I didn't want it, but what are some things that are a part of my life that I don't feel are great? Or, you know, what can I change? What do I value? How do I want to go forward?
Right.
You know? So, and that takes a lot of time. And again, it's also counter to what our culture and society tells us. They want, a lot of times, you to get back to normal, keep things going, all of that kind of stuff. And this can be little things and it can be big things. But just know this life with metastatic disease is a new normal. Like it's something different. And so as we dive into the mental part of it, like we're going to talk a lot about what are you thinking about and how can you wrap your head around that, and what do you need to kind of say, that's serving me, that's not serving me. You can control what you're thinking. You really can. You can do that by what you allow to come in. You can do that by slowing down the process and kind of analyzing what you're thinking. There's a lot of different ways to consider your thoughts and whether or not they're working for you.
Mm-hmm. And when you say this takes time, I tend to remember that. Mm-hmm. That because in your process of going through the treatment or the mm-hmm. that year that you spent in pretty hardcore treatment, coming out of that, there was almost I don't want to say not wanting to stop, but it felt like you went from killing cancer to not really doing anything.
Yeah.
And with metastatic cancer, as all of you know, there's not specific evidence that it's gone. There's not specific evidence that it's there. There's not specific evidence. You're just looking for stable. And that can be way more mentally challenging. It was more mentally challenging for you, for sure, after you got into the groove of treatment, and then stopping that next phase was tough for you.
Yeah, it's really hard because I think what I had done prior to that, and I guess if you're going straight to immunotherapy, you don't have to retrain yourself in this way. But I was kind of like, oh, well, the chemo's killing the cancer, or oh, we're doing all these things, which I felt like I relied on that for, mm-hmm. For how I felt. And so then to come into like this immunotherapy stage, which is, which I started on tamoxifen, and even some of it is just like, it was a tiny pill, and it felt like, how can a pill, how can this be enough, or, really making a difference? So it really is about training yourself to believe in what you're doing, and being able to kind of accept that this is a process or whatever, and that, you can work within it.
Sure.
But it did feel like, and I think people coming off of treatment, it does kind of feel like your support has been taken away in some ways, right? Mm-hmm. The things you depended on. So,
and very much getting in what you talked about here, very much being in the right mental standpoint to handle those things, to readdress or to how we think about things, how we think about our body now, all of that. The mental side of that is hard.
Yeah.
And takes practice in order to do that well. I don't know if that's the right word. But yeah.
Well, yeah. And one of the tips in here too, we talked about setting a goal. That was really helpful to me, was like, okay, what can I focus on now that's different, and that's not based on treatment so much as it's based on, what am I trying, what am I working towards or whatever. So, yeah.
And I remember one of the categories in here is labeled, it's not cancer.
Yeah.
And when, when you've trained your mind to really, to be honest with you, to focus on cancer.
To be hypervigilant.
Yeah. And then you want to actually probably go the opposite way of that in this, that's really hard to do.
It is. And I'm, for most of us, we start out kind of like 3 months scans, and then you push out and all of those kind of things. And it is such a mental process to not be either completely in the scan cycle all the time, because that's so draining and hard, but also when things pop up, to be able to say, no, that's not cancer. Like a lot of my issues in the last month they're all related to sinuses. I had crappy sinuses before all of this. They may have gotten worse, but like it's not cancer related. You know, it's kind of being able to go. Or I remember even sometimes you would say something to me like, no, listen, like it's normal for your back to hurt. You know, like my back hurts too. Or
you just
whatever.
spent 3 hours in the garden.
Yeah,
you know, stuff like that, reminding of of hey, we all have aches and pains too. You're just hyper vigilant to all of those because that's where your mind goes. Yeah, and you're probably never going to stop that.
No, I don't think so. That's the bad news. I think, I mean, it is the bad news, but it's also like it's important, right, to not be taking, you know, things that are happening to you and discarding them. It's that careful balance between,
because you do want to listen to your body.
Yes.
But you also have to then train and this is the mental side of going, okay, what else can it be? Could it be something else? Let's see how it is tomorrow and the next day, that kind of thing.
Yeah, and that's also that process that we've talked about on here before a couple times where I'll, you know, like if there's a specific something that's happening, say a pain in my back. I had a lot of bone mets in my back. I assume I didn't ask where they all were. But anyway, like if I'm getting a specific pain, it's like, okay, did I work out? That was always, you know, what could have caused this? And then kind of like, has it continued? And if it's continued for a couple of days, then it's, okay, I'm going to tell Larry about it. And then we can kind of problem solve it a little bit. And sometimes I can't, it's so crazy that sometimes just saying it out loud, it would go away. Like it really would. Or
sometimes whatever. I would identify it. That's definitely a muscle pain. Yeah. It's musculature. And so it has likely nothing to do with the cancer because of where it's at and how it hurts and what I can do to manipulate it. And
and if it were very persistent, then
absolutely
we call the doctor or use a portal. So there are ways to do that.
For sure.
I think for this part of or phase of treatment, for me, mental and physical are so intertwined because I worked from keeping my body physically strong was what helped me stay strong mentally. So we're going to move into like tips for physical, but it was really, for me, it was like, okay, I'm going to swing this focus into what can I do for my body, you know, to be as strong as possible. And so, it was about being intentional, about being, having a program. One of the tips in here is consider professional help. And that is, can you hire a trainer that you meet with even once every 6 weeks or once, you know what I mean? If you're not familiar with a gym, like weight equipment or, dumbbell, all that stuff, like hire somebody, pay somebody.
At least get started with it.
Yes. And, your confidence can build so much with that kind of stuff. But I think, I will say with physical, I think it's really easy, especially as women, to kind of go, oh, I'll just do some lightweight. That's really not all that your body needs. You know what I mean? You learn how to walk around a gym, or even, you can do it at home too, but get comfortable with equipment that can really help you build muscle and strength and all of those things. So, and also, I feel like it depends on who your doctor is, but like, it's okay to press those limits a little bit. I think a lot of times my doctor's always been very, very encouraging, right? Like, what are you doing? Are you lifting? More than that. But I feel like a lot of doctors are like, oh, just do your best. And it's like, okay, well, what's that look like? I mean, we know that our what really helps our bodies is, 8 to 10,000 steps a day, lifting a couple times a week, all of these different things. So doing your best, I think, is just kind of placates, but always it should be working towards getting stronger.
Yeah. I mean, and your oncologist, there's a reason why she wants you to be moving, wants you to be lifting, wants you to be working out every day. It's because that's what the studies are showing.
Yes.
She's a research oncologist.
Right.
And I know many oncologists are not research oncologists and doing fantastic things, but she is the tip of the spear.
Yeah.
That's the truth. She is uncovering things, and the data is absolutely showing that your immune system is supported by a body that strains itself on a daily basis. That's the truth. And I just, any oncologist that's saying not to do that, and I don't care what condition you're in.
Yeah.
It doesn't matter. Everyone can
always get stronger.
And we can all move.
I agree with that. And also, like, you know, I mean, I've come off a lot of surgeries too and been like, okay, I'll be smart, but I'm not going to be, like, just sit there, right? Can't think of the word right now. But yes, so I'll be smart about this, but I'm not going to just be sitting on the couch. So, yeah. And then, you know, the other thing is kind of starting to think about acceptance for your body at this point. Physically, you know, it's hard sometimes to physically accept your body when you sort of feel like, what's it doing to me?
And everybody's body is going to be different at this point,
Yeah.
for sure, depending on what surgeries you had or didn't have, or what treatments affected what.
And I will say, too, I think one of the things that women will talk to me about, you know, if they've had a tumor that's fairly large and they didn't have surgery, and I found it to be super empowering to watch it, like, you know, dissolve or go away. That was an opportunity I had that was a little bit different than what people who would traditionally start with chemo had, whatever. But it really is just about kind of talking to your body in a way that you would maybe talk to a friend, and being happy and proud of what your body's brought you through.
No doubt.
So, yeah.
And it's much more in the guide if you want to check that out. But that's the basics of it right there.
Yeah.
Okay, and then next is nutrition.
Nutrition. Okay, again, this is an opportunity to change things. This isn't a diet. This is an opportunity to be healthier. And by being healthier, I mean the basics of that is more fruits and vegetables, whole grains, lesser fatty stuff, right? Processed food, not so much. All of those kind of things. Like, I'm never going to say you have to do this. And I would say there are a lot of great foods in this world, but there is not one superfood. No. Not one, this is what kills cancer, eat that. You know, when you're talking about vegetables, are there rankings of vegetables? Sure, you should be eating like cruciferous vegetables, which is like broccoli and cauliflower and stuff like that. But you should also be eating spinach and things like that. So there's a lot of sweet potatoes are really good for you. Like all of those things. So for me, because I am not going to go to a store and buy all of those and consume them all, I just kind of try to think about rotating good, you know, fruits and vegetables into my diet. I try to have good sources of fairly lean protein in my diet. I do like, one of the things that I'm probably the most particular about is meat in terms of where we buy it from. What I used to think was, because we live in a rural area, I used to think that was challenging. Now it's actually like, oh no, these people grow really great cattle. Like their beef is really great around here. So nutrition is important. I will say too, focus on food over supplements. Like if you're like thinking, what should I take in terms of supplements? I would say first, like, what are you eating? Like supplements are important and great, but they are not a substitute for a good diet. So
supplements can be taken when a good diet is not working because you, for some reason, you're just not absorbing, and that can be for a number of different reasons, and specifically for metastatic cancer patients. You might just not absorb the volume of a nutrient, specifically minerals, the way somebody else will, and you might have to take a supplement to get enough of that absorbed.
Right. And we just, I mean, also, like, there's just not as much of that in our foods as there used to be. But, again, start with foods. So, set yourself up for success. Like you do have to plan some things. And by planning, like that means for me having Lara bars in my car so that when I'm hungry, I'm not going to go, oh, I'm going to go get something. You know what I mean? It's having a good choice most of the time. It's all of those things. It is looking for healthier alternatives to things. It's splurging, but not splurging all the time, right?
Yeah.
So
I think the biggest part of this is planning. I mean, if you don't plan, you're not going to have a very healthy diet. We all know that.
Yeah.
If everything's just on the spur of the moment,
yeah.
You're going to go with the quickest, easiest thing.
Yeah.
And it's not going to probably be the healthiest thing.
Yeah. And then again, also you need to kind of think about this is I'm doing what's best for my body and not like I'm depriving myself. So there's a big component of that too, to think about. But and planning for challenges too, right? We're coming into the holiday season. It's like, rather than just going crazy, like, what is my plan for this? Okay, I am gonna really enjoy this, but I'm not gonna take any leftovers home or whatever that looks like, mm-hmm. right? Just to make some choices that are helpful. So
it takes a really long time for your body to get used to a good nutrition program and a good fitness program. It's not going to happen fast, and that can be really frustrating to people.
Yeah.
But boy, when it does start when you see the results of it, you can reward yourselves a lot more than you think, and it won't also go back bad fast.
Right.
All right. When you spent those months and months and months, I'm talking about eating healthy and exercising, you absolutely can do things in moderation and not have the ill effects of it compared to prior to that.
Yes.
When you did it and you're just like, oh boy.
Yeah.
It's amazing. Yeah.
Yeah. And I mean, we always want such quick results, but I always think about one of the people that I follow on Instagram. He talks about, like, in particular with weight loss, like, if you lost 10 pounds in a year, when that year was over, you'd be happy that you lost 10 pounds.
No doubt.
You know what I mean? But that feels so slow. And like when we think about, a pound a week and all this stuff, it's like, that's ridiculous. But
we're talking about 10 pounds of fat.
Yeah, but yes. And I'm just thinking about how you look back on that and go, no, I'd be really happy if I lost.
Because people are used to seeing 3 pounds off the scale and thinking, wow, I lost 3. No,
and then
you didn't.
And then they give up.
It's
right?
water.
So it is kind of about making these changes that you can sustain. What works for you? What, and keep going with them, right? Like right now I drive, when I'm, driving to Indiana or whatever, it's a 3-hour drive. A lot of times after school, want a snack, I'm kind of hungry anyway, I keep lesser evil popcorn in my car, open up, you know what I mean? Mm-hmm. It's like good fiber, not a lot of calories, keeps me awake, chewy, all that kind of stuff. Like, have a plan. So, all right.
Bunch more in the guide.
Yeah. Medical. So medical, this is the kind of the time where more than ever, like, you're the captain, right? You're the captain of your team, which means, yes, your oncologist is important, but ultimately, you're the one that knows everything that's going on about you. Mm-hmm. So you have to take that role on and take it on seriously. It doesn't mean that you have to manage everything. You can give people things to manage for you, but I am responsible for my health and all of that kind of stuff. So scheduling is also a big part of living with metastatic cancer. I would just say, I think we kind of, because we're so used to like listening to our doctors and feeling like they know everything, and they know a lot, but it doesn't mean that you have to schedule everything exactly like they say. Yeah. They want you to live your life also. So like,
but they have 1,000 things going on.
Things going on. And I mean, honestly, like, even their holidays might not be your holidays. Mm-hmm. Like, all of those things, it's okay to kind of say, hey, we usually do this. Can we work around it somehow? Or we've talked a little bit in the past about, like, I don't schedule scans around a time that I really just want to be in the moment. You can schedule around things. And I would say that you should.
Yes.
So, and yeah, a lot of this is just also about kind of managing your anxiety and figuring out how to kind of advocate for yourself. There's so many things with this within the medical realm that it's just like, how can I speak my voice without having to feel like I'm 24/7 a cancer patient? Mm-hmm. So, yeah.
Okay. And then finally, a big change is your support network and what you need.
Yeah.
Those changes to you're not in treatment right now traditionally with cancer. You are maintaining, but you still need support. You
do. Well, and also like, again, kind of going back to what we talked about, that new normal at the beginning. This is your time to figure out what works for you, and you get to, if things are, you might say, I want to work full time, and that's working for you. That's great. I mean, you might also be like, I'm working full time and I need to, but like, it's really hard on me. Like, working towards is there some flexibility you can get? Can you enact FMLA? Do you need to work full time? Can you get Social Security disability?
Can you work full time and still do all of those things we've been talking about? For the last...
so that focus, you're talking about kind of shifting that focus to how do I better take care of myself, and then what does that look like? And so it doesn't mean that like you don't have to make every change right at the beginning, but with this kind of stuff, I feel like this, to me, support is kind of about all the other things that go on around you, and so what feels good? What do you maybe want to just go, nope, I'm out of there. I don't want to do that anymore. Your friends might change. There's a lot of things that happen.
Might meet new friends.
You might meet new friends. Exactly. There's you have to kind of be gracious with yourself, but you also have to listen to what's working, and you need to listen to you. I feel like, and maybe this isn't the case with you, but support sometimes looks like a lot of people telling you what you should do. And you have to be able to go, oh, no, that doesn't work for me, right? Mm-hmm. Or just because so-and-so managed it one way doesn't mean that you need to manage it that way. Or just because your mom is telling you that she thinks this, it might not be for you, Mm-hmm. So, yeah, this is your opportunity, like I said in the beginning, to build this life, and your goal is to build the longest, happiest life you can, right? Mm-hmm. So you are going to need some ways to be able to reset from time to time and different things like that. And honestly, I will say also, as far as work goes, like, sometimes we don't know because we don't ask. So besides the laws being what they are, in terms of being able to support you, I mean, FMLA doesn't mean you have to leave. You can take an FMLA day every 3 weeks. It's sometimes we build it up to be one thing, and it's got a lot more flexibility. Sometimes your employer might go, no, I really want you to be around. How can we help this? Mm-hmm. Or what would a different role be, or all of those things. I think sometimes we don't have because we don't ask. So,
probably true.
All right.
Okay, so that is the last of the 5 to Thrive guides.
Yeah.
So hopefully you guys can help us spread the word on these and get them in the right hands.
They are available at heatherjost.com.
Oh, so. Okay. And I would just say this, that you might be in this maintenance phase, or have been in this maintenance phase for 5 or 6 years, but just feel like you're kind of trudging along. Yeah. There's some really good pieces of advice in here that could probably help you too. Well, honestly, the pieces of advice in here can probably help anyone, whether you're in a maintenance phase or honestly ever had cancer. It's just pretty healthy things that have been put together in one little guide for you. So, yeah.
All for the price of a cup of coffee.
Oh, okay.
Right. I don't know if you were to, whatever. I would never pay $9 for a cup of coffee, but
no.
Anyway, $8.99. Worth it. You can download it.
Definitely.
You can print it. You can read it off your phone. You can do anything you want with it. But,
there was a hell of a lot more than $8.99 of work that went into it.
Yeah, for sure. Hours and hours and hours.
So hopefully you like it.
All right. We'll talk to you next week.
See ya.